Okay, well, welcome to the Biological Station. My name is Knut Nadelhofer, and I am a professor in the Department of Ecology and Evolutionary Biology at the University of Michigan. I'm also privileged to be the director of the University of Michigan Biological Station, about 20 miles south of the Mackinac Bridge in northern Michigan. Welcome to the third public lecture of our 2020 season. We're very pleased to share these lectures not only with our students who are operating remotely, our faculty and staff, but also with our neighbors, alumni, friends of the station, and any of you who are interested in sharing a University of Michigan biological station experience. I encourage you to use the Q&A option to comment on or ask questions of our speaker. She will address those questions in a Q&A session following the talk. The talk will also be available on our UMBS YouTube station, which you can get to from our website or our Facebook page in a few days. We deeply regret that our field station campus is closed to the general public and is not hosting on-site field classes this year. This is in response to the COVID-19 pandemic, which is now challenging human health and well-being across our state, our nation, and the world. Our classes are being conducted in cyberspace, with our students conducting field research from wherever they may be living this summer, and discussing their work with their instructors and their classmates online. Distance learning and teaching present personal challenges to all of us. These challenges are exacerbated for too many of our students, by financial insecurity, limited access to healthcare, food insecurity, and extreme weather events. Of particular grave concern are the too often lethal impacts of systemic racism, yet another virus that is plaguing our nation. We acknowledge that the entire state of Michigan exists on colonized land that was appropriated from indigenous peoples in the 19th century. The biological station operates on 10,000 acres of nearly 14 million acres of northern Michigan that was appropriated and forcibly ceded to the US government from ancestors of our Anishinaabe neighbors by the Treaty of Washington in 1836, 1 year before Michigan became a state. We are grateful to the Ottawa and Chippewa nations and other Anishinaabe peoples for their many centuries of sustainably stewarding our lands, waters, and resources, those resources and the environment that we now share with them. We're pleased and honored to have Dr. Mona Hanna-Attisha to give this year's Pettingill Lecture in Natural History. Why a natural history lecture from a physician, a pediatrician who's discussing the Flint water crisis? The answer, I think, is because humans are a part of the natural world. For too long, we ignored that. Human health and well-being are dependent on how we treat the environment and how we manage the priceless and vital natural resources it provides. So I'll say a little bit about Dr. Olin Sewell Pettingill. He taught introductory and advanced ornithology at the biological station for 35 years, between 1938 and 1974. His contributions to ornithology were broad and significant. In addition to his love of teaching, he was an active writer, publishing approximately 100 scientific papers and books. In fact, he wrote the first textbook of ornithology called A Laboratory and Field Manual of Ornithology in 1939. It was essentially the only ornithology text that was used for more than a half a century. In fact, it was a text in my ornithology class at the University of Wisconsin in the late 1970s. He also pioneered the concept of bird travel guides through publications of two classics: a guide to bird finding east of the Mississippi in 1951, and a guide to bird finding west of the Mississippi in 1953. Pettingill's style in the classroom and field was legendary. So was his preference for the color red. In honor of that, the Pettingill classroom at the biological station has red tables and chairs to this day. Dr. Pettingill was well known for his efforts to educate the general public about birds. He was the editor of Cornell's home study course in bird biology and one of the National Audubon Society's screen tour lecturers starting in 1943. He was a highly recognized photographer and videographer. His work on birds was featured in some of the first natural history films produced by Walt Disney. He was born in Maine, attended Bowdoin College, and obtained his PhD at Cornell, and taught for 17 years at Carleton College in Minnesota, before accepting a position as the director of Cornell's Laboratory of Ornithology. He retired from Cornell in 1973 and from the Biological Station in 1974. He receives many awards for his contribution to ornithology, including the Arthur A. Allen Award and the Ludlow Griscom Award. Many of his more than 800 students at the Biological Station continued on to become some of North America's leading ornithologists at public and private institutions. He last visited the station in 1993 at the time of the bird class reunion. He died in Bedford, Texas on 10 December 2001 when he was 95, and his friends and relatives established the endowment that brings Dr. Mona Hanna-Attisha here tonight. Dr. Mona Hanna-Attisha received her Bachelor of Science degree from the University of Michigan School for Environment and Sustainability, then called the School of Natural Resources and the Environment. That was in 1998. She went on to receive a Master's of Public Health degree from the School of Public Health. She spent the summer of 1997 taking classes and conducting research at the Biological Station, where she shared a cabin with her high school friend, Elin Batanzo, who is now an environmental engineer and an expert in water quality. I'm sure Dr. Hanna-Attisha will mention her relationship to Elin during her talk. Dr. Hanna-Attisha received her medical degree from Michigan State University, and she completed her residency at Wayne State University Children's Hospital of Michigan, where she also served as chief resident. She's now a pediatrician at the Hurley Medical Center in Flint, an associate professor in Michigan State University's Department of Pediatrics and Human Development, the C.S. Mott Endowed Professor at the MSU Med School, Division of Public Health. Importantly, she's the founder and director of the Pediatric Public Health Initiative, which is a partnership between Hurley Medical Center and the Michigan State University, where she works to mitigate impacts of lead exposure on Flint's children, to whom she is known as Dr. Mona. At great risk to her career, Dr. Hanna-Attisha revealed the findings of her study of Flint water and, well, of Flint children and lead contamination at a press conference before her research was published or peer-reviewed, because of the urgency of the crisis she had identified. She's testified 3 times before the U.S. Congress. She's been awarded the Freedom of Expression Courage Award by PEN America. She was named one of Time Magazine's 100 most influential people in the world for uncovering the Flint water crisis and leading recovery efforts. Dr. Mona has been interviewed on CNN, MSNBC, BBC, and National Public Radio. In fact, as recently as last week on Michigan Public Radio. Importantly, she's the author of a 2018 book, What the Eyes Don't See, which the New York Times named as one of the 100 most notable books of that year. I encourage you to buy a copy online or check one out from the library or buy an ebook. It's an incredible story. And we are very pleased to have Dr. Mona Hanna-Attisha herself back at the Biological Space, well, back in cyberspace at the Biological Station to speak. And we're anxious to learn more about you, Dr. Mona Hanna-Attisha, and your work. So please, thank you for coming, and remember to type in any comments and questions to the Q&A link at the bottom of your screen. And again, welcome Dr. Mona Hanna-Attisha.
Thank you, Newt. Thank you to everybody who's joined us virtually. It is so exciting to be with all of you. I had so much fun creating this presentation because it was a trip down memory lane. It was 23 years ago that I was at the biostation. I'm wearing my biostation shirt from the Spring Ecology 1997 summer class. So I've had made amazing memories, and really it was one of the foundational experiences that really guided me to become a scientist and a researcher. And it really all started with snails. So I'm going to tell you a little bit about my summer at the biostation and my work with snails. So I like I said earlier, I came to the biostation in the summer of 1997, made tremendous friends. A lot of my classmates were at the biostation. Like Newt mentioned, My undergrad was in the School of Natural Resources and Environment, now the School for Environment and Sustainability. So it was all the kind of environmentalists. My official major was resource ecology and management. So I learned about forestry and geology and landscape architecture and environmental policy. So my path to medicine wasn't direct. It started out in environmentalism and ecology. I had previously spent the summer at U of M's Camp Davis in Wyoming. I took a geology class there, and that was an amazing experience. And I was looking forward to a similar summer at the biostation. And I was also excited to come back to the biostation because I was coming to the biostation with a high school friend. So this is my friend Elin Batanzo. We went to high school together. We're both involved in environmental activism as high school students. We helped close down a local incinerator in Metro Detroit in Madison Heights. And that really kind of was a foundational experience for us. And she went on to environmental engineering and I went on to environmental health. The picture on the left is actually from high school. We were at I think a Greenpeace rally. The sign says, "Help fight cancer, stop the nuclear industry," or "Stop nuclear industry." So like, who knew as a teenager, I had already started to make the connections in environmental health. She went on to Carnegie Mellon University for her undergrad training, but we were so excited to be able to spend the summer together at the biostation. So she came from Carnegie Mellon to spend the summer at the biostation, and I came from U of M. She went on to be an environmental engineer and later a drinking water expert working at the EPA and other water utilities. And we'll come back to kind of that connection that was really solidified at the biostation later on in the story. So I spent my summer learning about snails, Campyloma snails, and I actually dug up this research paper that I wrote. I can't believe that I still had it. So I showed it to my children. I shared with the team earlier that I actually have always saved the Campyloma snails that we researched. They've always been kind of on my little desk. So these are the snails, and we measured them and collected them and looked at their apertures. And there's a picture of me here with one of my teammates on Excel, putting in numbers, doing the science that helped create this research paper. You know, but the most important research paper that I then published was about the Flint water crisis, and we'll definitely get to that. But I cannot really underestimate the role that the biostation played in my life as a scientist, as somebody who cares about our natural environment, as somebody who cares about the holistic ecosystem, but somebody who's also who can work in a team. So I'm grateful to that experience that, which is so shocking that was over 20 years ago, that has played a tremendous role in who I am today and what I have been able to do. So I mentioned this research paper, and we'll absolutely get to that research paper. And I just kind of want to touch a little bit on my path, which Newt kind of touched on. So after graduating from the School of Natural Resources and Environment, where I spent a lot of time doing kind of creating my own major in environmental health. I spent a lot of time doing research in the School of Public Health and reproductive toxicology. I then decided to go into to kind of make that connection in between environment and health even stronger by going to medical school at Michigan State University. Michigan State University's medical school is a community-based medical school. It was all about kind of primary care and working in a community, specifically underserved communities. So I actually did my clinical training, my last 2 years of medical school in Flint, as one of their kind of pioneer clinical campuses. And it was then as a medical student that I really fell in love with the city of Flint. And I also fell in love with the discipline of pediatrics. That took me to Detroit, to the Children's Hospital of Michigan, affiliated with Wayne State University, where I did my residency, which is additional training in medicine. I spent another year as a chief resident, stayed on faculty at Wayne State. During that time, I went back to Michigan to get my master's in public health and health policy. I loved taking care of one kid at a time, but I knew that if I was going to make an impact on a population level, that I would need to have kind of the skills and the tools to be able to understand things like epidemiology and biostatistics and health policy and health economics. So I went back to school to get that degree in health policy. And then in 2011, I had an opportunity to come back to Flint as they were beginning to really explore the possibility of merging the fields of medicine and public health. Michigan State University wanted to explore how they could do more in public health in Flint. They asked the community, which is really unprecedented, what do you want, if we were going to bring in researchers here, what do you want us to work on? And the community responded with thousands of surveys and town hall meetings, and identified like 3 big issues that if researchers were going to come into the community, they wanted them to address. And those issues were behavioral health, healthy behaviors, and chronic diseases, just really big bucket issues. And based on what the community wanted, MSU began to build this public health programming in Flint, hand in hand with community members, and really focus not on kind of observation research, but really implementation research. What can we do to improve the public health situation in Flint? And this was 2011, before the water crisis. And because that was happening in Flint, that was one of the reasons that I was drawn back to Flint. I was drawn back to Flint to be, as you can see in this picture, a pediatrician, but not just a pediatrician, but also a medical educator. So I came back to Flint in 2011 as the pediatric residency director on faculty with Michigan State University, really working to train the next generation of pediatricians. So this is me and my clinic. Our clinic is awesome. It was opened in 2015. It's atop a farmer's market. It's across from our central bus stop. It's a really innovative clinic that really tries to address a lot of the social determinants of health that impact our patients. And I want you to meet one of our patients who is in this photo. This is a little girl named Nakala. And if you've read my book, you know her story. So this was in the summer of 2015. And this was Nakala coming in for her 4-month checkup. And at that time, her mom, we were going through kind of all the things that we do in routine pediatric visits. We obviously do the physical, and we listen to heart and lungs, and we check their growth and their weight, and we give immunizations, and we talk about safety and all these different things. And a big component of these visits is nutrition. You know, formula, breast milk is the most important thing that babies get at this age. It's really the only thing that babies get at this age. And it was at that moment that Nakala's mom shared that she wanted to stop breastfeeding and that she was going to transition to formula. And then I tried my pediatrician best to encourage her to continue breastfeeding and shared all the science, the evidence of the benefits of breastfeeding. Nakala's mom said that she had to go back to work. She was a waitress. There was no place for her to pump. She couldn't afford staying home. She could hardly make ends meet. And she had made up her mind, and she was gonna introduce formula. But she asked me a question. And when she asked me this question, she had a kind of a look in her eyes and her face that I see really in the eyes of all parents who are worried about their children. And she asked me, is the water okay? And that's because you use tap water to make formula. You mix tap water with powder, and that's how you make formula. And she was asking me if the water in Flint was okay for her to mix her baby's formula in, which, remember, is the only thing that children get until about 4 to 6 months of age. And at that time, I had heard kind of vague reports of water quality and odor and taste, but there was so much reassurance out there that the water was fine. And, in the back of my head, I was thinking, like, how could our water not be fine? Like, yeah, we had this water switch, but like all these government officials and scientists, everybody was saying that it was okay. And like, we're in the middle of the Great Lakes. Like, how could our tap water not be okay? And this is America. It's not like a third world country. Like, how, there's rules and there's regulations and there's laws and there's policy and there's people that our tax dollars pay, that when they, that's their only job, is to make sure that when we turn on our tap, if we're in Flint or Detroit or Pellston or wherever, that our water is supposed to be okay. So I had all these kind of thoughts in my head where I was reassuring myself that of course the water was okay. I mean, how could it not be okay? And so I told her, like, yeah, you go ahead, don't waste your money on bottled water. That's expensive. Don't waste your money on bottled water. The tap water should be just fine. This was the summer of 2015. And and obviously I know now, that the water was not just fine. You probably remember these kind of pictures, the brownish, yellowish, greenish water that was coming out of people's taps. And from what so many of us, we saw these pictures and there was a bit of a disbelief, like this can't be real. Like, this can't possibly be happening. Like that's like a problem over there with those people. Like I'm not gonna worry about it. I don't even believe it. Like maybe it's photoshopped or maybe it's fake news. Like how can that really be something that is happening in this country, in this Great Lakes state? But this was happening. And you all know now that what happened in Flint is probably one of the most emblematic environmental and public health crises of our time. Obviously, now we're amidst another public health crisis. You know that the story of Flint is a story of what happens when we disrespect science, when leadership doesn't value public health, when we fail to invest in public health infrastructure, when we neglect certain populations. So there's so many lessons of Flint that are so resonant to today, and especially to the current pandemic, which we'll talk about a little later. But I want to touch base or reiterate that the story of Flint and our water crisis, which we'll get into more, didn't happen overnight. And it's really important to understand the history of how it came to be. If you've read my book, there's a lot of history in there. There's Flint history and public health history and lead history and family history. I was always taught that of the importance to learn from our history, to recognize that we step over complex systems every day. And so often we close our eyes to anything that's dark or uncomfortable, but we really have to understand our history. And I think we're actually kind of in this moment in our nation where people's eyes are finally opening to the history of our nation, which many folks have largely been unaware of. So, I see so much of our practices as being ahistoric, like we lack kind of the recognition of history, but for us to understand kind of where we are, we have to understand where we came from, or else it's impossible for us to really move forward. So before the water crisis, in terms of the history of Flint, Flint was well known for something else. And usually if we're together in a room, you guys would shout out, Flint was well known for cars. So cars is, we're born in Flint. Like Flint was literally the birthplace of the automobile. We put America on wheels. Flint was the birthplace of General Motors. But really more importantly than being the birthplace of cars, there's something else that Flint is famous for that happened shortly after cars were coming out of those assembly lines. And that is the birth of labor and the UAW. So this is a picture from the 1930s of kids, which is amazing, and really kind of resonates with me because Flint kids have always been so resilient and so strong and so visionary. So these were kids who were protesting for better wages, for better working conditions, for occupational health and safety. They were protesting for a better life. So the strike was the historic sit-down strikes, the Flint sit-down strike. It was also known as a strike that was heard around the world. And for 44 days, auto workers literally sat down in car plants, in several GM car plants in Flint, shut down production, and demanded a fair share of prosperity. They demanded to be compensated. They demanded better health and safety provisions. They demanded benefits, and something amazing happened. They won. Their union, the UAW, was recognized, and this was largely due to Michigan's governor at that time, my favorite governor, Frank Murphy, and also the intervention of President Roosevelt. So their union was recognized, and that ushered in really the birth of the middle class. So more importantly than Flint being well known as the birthplace of cars, Flint is also the birthplace of the middle class in America. The very first subdivision in America was in Flint. Flint became this kind of promised land. People from all over the world, immigrants, but also many African Americans in the Great Migration North, moved to Flint for opportunity, for prosperity, for jobs, living wage jobs, for great schools. Community schools was born in Flint in the 1930s, for great infrastructure. The list goes on and on. And it wasn't even that long ago, it was the 1970s. Flint had the highest per capita income in the entire country. Like, imagine that. Like, the people of Flint had the highest per capita income in the entire country. And today we are the poorest city of our size in the entire country. So the history that followed is as important. And this is a history that's often kind of whitewashed. It is a history that is not dissimilar to many post-industrial cities. It is a history of greed, of racism, of capitalism, of neglect. Plants closed, jobs were lost. There was a lot of kind of outsourcing and automation and globalization. There was, like in many communities, historic and systemic racist practice for real estate and housing that left the community very segregated. Highways cut through African American communities in Flint. They extracted the wealth. There was a lack of regionalization that prevented a lot of the revenue from being shared, which really created the city center grossly bankrupt. And that put Flint in a state of crisis really for decades before our water crisis. Every disparity you can imagine we had, which were many of the reasons that MSU decided to take this deep dive into public health in Flint, from asthma rates to infant mortality to life expectancy. Within Genesee County, where Flint is, within 2 parts of Genesee County, you can have a 20-year difference in life expectancy just because of the census block that you live in. And that's also not unique to Flint. That is something that is similar throughout this country. We have a 70% child poverty rate, which is astonishing. We have no full service grocery stores, one of the highest violent crime rates in the country. So the list goes on and on and on of all of these significant social determinants of health that were impacting the people of Flint. So when my new doctors start, and they always start in July. So, congrats to all the new doctors that just started. And, one of the things that I share with them, and it's always like an ego deflating moment. I say, hey, congratulations, you're a doctor. You have this long white coat. That's awesome. But I also share with them that, hey, you know what? Medicine actually contributes to about 10 to 20% of health outcomes. That there's all these other things that we have to be aware of, like the economics, the history, the nutrition resources, the environmental conditions, that also play a really great role in the lives of our patients. And if we truly want to help them, we have to understand all these other things. So I share a poem with my learners, and it's a poem that I also include in my book. It's a poem from 1938. It's called A Worker's Speech to a Doctor. It says, "When we're sick, we hear, you are the one who will heal us. When we come to you, our rags are torn off and you tap around our naked bodies. As to the cause of our sickness, a glance at our rags would tell you more. It is the same cause that wears out our bodies and our clothes." So that was written in 1938. We have absolutely come a long way since 1938. But in some respects, the cities, the conditions of our cities, the environment, the air, the dirt, the soil, the water, the violence, the stress, the hopelessness, these conditions still play a tremendous and preventable role in the lives of our patients, and they're largely unaddressed. So this kind of was the condition of Flint, this kind of chronic state of crisis And then the water switch happened in April of 2014. And the water switch happened because, Flint was in this kind of dire economic state. So the state came in and took over. So in 2011, Flint lost democracy. We were under emergency management. We had a series of 4 emergency managers, and their job was something called austerity. It was to save money. So they were all about cutting costs, really with no kind of recognition of the consequences of those costs. And the emergency managers decided that to save money, we would change our water source, that it was now too expensive to continue drawing water from the Great Lakes. We used to purchase our water from Detroit, water from Lake Huron, that, to save money, we would start drawing our water from the Flint River, the local Flint River, until a new pipeline to the Great Lakes was to be built. So it was supposed to be just a temporary thing, a temporary switch in the water until this bigger pipeline was to be built. And it was all done under this time where the people of Flint didn't have control of the city. They were under state control. So, during this time, this year and a half for me, like I mentioned earlier, like I heard these vague concerns in the local media about like color and odor and taste. And we also had bacteria issues in the water. So we had several boil advisories, but then there was an all clear that was fixed. There was even news that General Motors, who, like I mentioned earlier, was born in Flint and still has a plant in Flint, that they noticed just a few months after the water switched, that the water was corroding the engines in their engine plants. So they were allowed to go back to Great Lakes water. This was in 2014. And throughout this whole time, the people of Flint were told to relax, that everything was okay, that, everything is testing fine, everything is in compliance. And so once again, that's what I was kind of telling my patients. So, of course, everything was okay because all these people in charge who are experts in water and drinking water are saying it's okay. And that all changed for me in the summer of 2015 when I reconnected with my biostation buddy, Elin, who just by randomness was over at my house. She had spent most of her career in the Washington, D.C. area. I mentioned earlier, working for the EPA and working for different public water utilities. And she had decided to come back to Michigan to be closer to family. So we were reconnecting. I texted her one morning. I'm like, hey, want to come over? Our kids can hang out. We can reconnect, see how you're doing. So it was kind of a last minute barbecue at my home. And Elin shares at my house over a glass of wine, because all good stories start with a glass of wine. And she shares, hey Mona, what's going on with the water in Flint? And I share, everybody's saying it's okay, and that's what we're telling our patients, that it's okay. And she shares with me that she had just seen a memo from her former colleague at the EPA, who she knew and trusted, and her former colleague was saying that there was lead in the water, and that the water wasn't being treated properly, and that this is probably a widespread problem. So that was the very, very first time that I heard about the possibility of lead being in our water. She shared that the water wasn't being treated with an important ingredient called corrosion control, which is a federally mandated ingredient that prevents whatever's in the pipes from kind of coming out of the pipes and into the drinking water. And without that ingredient, our water in Flint was about 20 times more corrosive than the water that we had been getting from the Great Lakes. And that's why, those engine plants were corroding. That's why people were having problems with appliances, like their dishwashers and their washers and dryers. Things were corroding because this water was not being treated properly. And it was corroding the pipes, which have a lot of lead in them. And we'll get to kind of why they have lead in them soon. So to give you kind of a frame of kind of what the numbers looked like in terms of what was happening with the water. So the EPA has something called a maximum level contaminant goal for lead in water. And that's 0 parts per billion, recognizing that there is no safe level of lead. The American Academy of Pediatrics has a recommended level for water in schools at 1 part per billion. Bottled water is regulated under the FDA, the Food and Drug Administration, and that has an action level of 5 parts per billion. The action level for lead in water for a water system, so an entire public water utility, is 15 parts per billion. This is the level where utilities have to start taking action to lower that level. It's not the safe level, but it's where they start taking action. And I think my lowest day in this crisis was when I found out that a home adjacent to our hospital for foster kids and kids who've been abused and neglected had a lead level of 5,000 parts per billion. And the highest level that I saw was a home with a lead level in their water of 22,000 parts per billion. So when the EPA finally did come in, when we were a federal emergency, they said it was like we were drinking through a lead painted straw. Our pipes were so severely corroded that the lead scale was just coming off those pipes. So lead was used in our plumbing, our drinking water infrastructure for over a century. It's been used actually since the Roman times. There's actually theories coming out of the University of Michigan that hypothesize the demise of the Romans is because they used so much lead, not only in their drinking water infrastructure. If you go to Pompeii, you can see the preserved lead pipes. They also used lead as a food additive, like a salt, which is obviously not a good idea. But yeah, the word lead actually comes from the word plumbing. So lead, the elemental symbol for lead is Pb, which in Latin, plumbum means plumbing. So the word lead actually means plumbing. So lead service lines, which are those pipes that go from the water main to your front of your house, weren't restricted until 1986. And lead in fixtures and faucets, like brass fixtures and faucets, like your kitchen tap, wasn't restricted until 2014. So despite knowing the science of lead, we were slow as a nation to put into the policies of eliminating this neurotoxin. So what does the lead do? What did I find out when I heard about the possibility of lead being in the water? Lead is probably the oldest and most well-studied neurotoxins. I told you about knowing its badness since the Roman times. Incredible science, especially over the last few decades, has told us that there is no safe level of lead, and it impacts especially developing children. It impacts cognition, so it can drop IQ levels, causing learning disabilities. It can impact behavior, including causing things like attention disorder, impulsivity. It's been linked to criminality. Every kind of it's been linked to early exposure to lead has been associated with adult hypertension, high blood pressure, gout, kidney disease, early dementia, and the list goes on. So in a book, there's a book called Lead Wars, where the author calls lead a multi-headed hydra, because whenever you turn, there's another research study out there sharing the badness of lead. And that's why kind of the scientific community, the CDC, the World Health Organization, the AAP, has clearly stated that there is no safe level of lead, and that our focus needs to be on something in public health that we call primary prevention, which is preventing anyone from being exposed to lead in the first place because of that no safe level of lead. I also freaked out when I heard about that there might be lead in the water, because I know that lead is a form of environmental injustice. And that's something I learned about back when I was an undergrad at U of M in the School of Natural Resources. A couple of my professors were Bunyan Bryant and Paul Mohai, who were really the leaders of the environmental justice movement. And even back then, 20-ish years ago, lead was well recognized as a form of environmental racism. Our Flint kids already have higher lead levels, just like kids in Detroit and Chicago and Baltimore and Philadelphia. kids who are already suffering from so many other toxicities that threaten their life course. And even though as a nation, we've done a better job decreasing overall lead levels because we got lead out of gasoline and paint, that lingering legacy still persists, and the burden is not shared equally by our nation's children. It continues to predominantly impact poor and predominantly minority kids. And I was, recognizing this because of, back when I was an undergrad, learning these concepts, reiterated the need for action. Another person taught me a lot about lead, and she's probably my favorite U of M alum. And it is a woman named Alice Hamilton. So Alice Hamilton is an absolute badass. She is an amazing woman. She graduated from University of Michigan's medical school in 1893. She then went on to Chicago, where she worked with Jane Addams at the Hull House, where she provided well child care and wraparound services, especially to the poor and to recent immigrants in the Chicago area. And it was there that she started to recognize that a lot of the conditions that her patients were coming in with were related to what they were being exposed to in their workplaces. For example, hatters were going mad because of mercury exposure, and people working in the lead industry would be coming in with seizures and coma and death. So she quickly became our nation's expert in lead poisoning in the 1920s. So a century ago, she was our nation's expert on lead poisoning. And she's also known as the mother of occupational medicine. She was the first woman professor at Harvard in 1919, very first woman professor at Harvard. And this is just fascinating history. She had 3 stipulations for her hire as a faculty member. She couldn't go to football games, which is probably fine. She couldn't go to the faculty club, and she couldn't march in commencement. I had the honor of delivering the Harvard Medical School commencement address last year in person, and I had all the women faculty stand up, because if it was back in the day of Alice Hamilton, they wouldn't have been able to even be in that procession. But Alice Hamilton, like I said earlier, was knew about lead and its evilness a century ago. And at that time, she was battling a different lead villain. So in the 1920s, General Motors, which is part of the story throughout, wanted to put lead in gasoline in the form of tetraethyl lead because they said that it was the best thing that they could figure out to prevent something called engine knocking, which was a loud noise that cars made when kind of fuel and air mixed. And they say they tried all these different things, there was no alternative, and they had to put lead in gasoline. And Alice Hamilton fought them with all her might, saying that this would be a public health disaster, that it would be a global exposure to this poison. People had already been dying at some of the plants where they were making tetraethyl lead. People were being had seizures, and they had to be escorted in straitjackets because of their exposure. So even back then, they knew it was bad. But the lead industry instilled doubt in science. They hired some apologists, some fake scientists who manipulated governments and to claim that lead was safe. They even called tetraethyl lead a gift from God. And General Motors had a patent on tetraethyl lead, and they were set to make quite a bit of money. Contrary to her recommendation, lead in gasoline was allowed and persisted for decades, and has silently really poisoned the potential of generations of children. But I just kind of want to share the story because she's a U of M alum. She's one of my heroes, but also to share how important it is for us to understand the history. There's a long history of industry's role in profiting from making people sick from contaminations. And we really have to reshape our public health systems. We have to be governed by the precautionary principle, which is all about making sure things are safe before they're used, rather by something called the keyhole paradigm. And that is that was created by one of General Motors' scientists. His name was Robert Kehoe, who made a deal with the Surgeon General at that time. He said, if you can prove that lead is bad, we will take it out of gasoline. So that really set us on this dangerous precedent, this path, where it was the assumption that things and chemicals and poisons and toxins were safe until proven dangerous, which is the opposite of common sense and the opposite of how we should be governed, where it is we should be assuming things are dangerous until proven safe. And that really kind of put the onus on scientists and folks who for decades with painstaking research have been working to prove that things are not safe. And even when they do prove things are unsafe, they face many battles to restrict its use in the population. So that's a little more of a history lesson. So let me kind of move on to what happened next. So when I found out the possibility of lead being in the water, my immediate thought went back to Nacala and to the thousands of other Flint children, especially the ones entrusted in my care. My job as a pediatrician is so much about making sure that the kid in front of me is healthy and safe today. But really my job as a pediatrician is to make sure that they have the brightest future possible. Everything that we do is really focused on prevention and making sure that our kids have the optimal future ahead of them. Yet what was happening in our water was really threatening the tomorrows of a population of children. So I tried to get the research, trying to get the numbers on children's blood lead levels. It's part of public health surveillance systems. So all blood lead levels are automatically sent to county and state health departments. So that's one of the jobs of kind of public health and public health infrastructure. That's one of the things they're supposed to do surveillance on. So I tried to get those population level numbers, but was met with roadblocks everywhere. So actually then went to our own electronic medical record, our kind of computer system, and dug up through proper research protocol and IRBs, the lead levels of all the children whose labs were processed at our hospital. And what we discovered was that contrary were happening in our nation, in our state, and even our city, where lead levels had been going down. Lead levels after the switch had gone up. They had gone up more in the areas of the city where the water lead levels were the highest. And there was no change outside of our city limits. So it was only something that was happening within the water limits. So after finding these research results, like Newt mentioned in the beginning, I had a press conference, which is not something that researchers do. That's not something we were taught to do at the biostation. When we had research, we published papers. But that process of publishing, that peer review process takes time. And it can take months. And for those of you who have been part of this, it's painstaking. And our kids in Flint didn't have another day. So we held a press conference, really in collaboration with the greater medical and public health community, to share this research and to demand action, to demand that the water be switched, to demand a health advisory. And I felt great. I'm like, awesome. I'm sharing science. I'm sharing numbers. I'm sharing research and p-values and statistics. Like, you know, this is great. Like, you know, the government's going to take action. Kids are going to get protected. And that's not exactly what happened right away. There was quite a bit of backlash by folks who denied and dismissed the research. And for a moment, I also kind of began to second guess myself. I had all the feelings that most whistleblowers have when they're trying to really speak truth to power. There was feelings of being intimidated and being retaliated against, and feeling defeated and small, and being anxious and scared, and all these different things. You know, with kind of the support of so many, but most importantly, the kids, we were able to kind of regroup and fight back, and fight back with more numbers, and share the evidence, and and finally got the state to concede that there was a problem. They eventually went back to their surveillance data and also said that, yes, we are also seeing the same thing. Our research was published eventually in the American Journal of Public Health with some really cool maps in partnership with our geographer colleague. And then that research was also validated by the CDC, who had access to the larger data set. So really from the moment of kind of uncovering this population wide lead exposure, my focus and my team's focus has really been about what's next. So we failed at that primary prevention, which was making sure kids were never exposed. So then that puts us into this work of secondary prevention, which means what can we do to make sure that our kids don't suffer the consequences of this water crisis? The water crisis wasn't just about lead. We had an outbreak of Legionnaire's disease, which was a pneumonia that actually killed people. There was massive kind of skin issues, but also it was just a population level trauma. There's raw feelings of anger and betrayal and lost trust and guilt and anxiety that are still palpable to this day. So our focus really kind of shifted to how do we put into place the science, the interventions to make sure that not only do our kids recover, but really thrive from this crisis. And my work in pediatrics, and then especially our work post-crisis has been governed, like I said, by prevention. And so much of what we do is prevention. And this is one of my favorite quotes that I have lived by Frederick Douglass, who said this about 150 years ago. He said, "It's easier to build strong children than to repair broken men." So it is so much better and easier and more cost effective to focus on prevention than to really, take care of people after they're sick. And this also very much speaks to kind of our current crisis with the pandemic and really our healthcare system in general. We spend a lot of money on a system that's really focused on sickness. We spend more money than any other nation taking care of people after they're sick, but we don't spend that much money taking care of people when they're healthy and putting the systems in place to make sure that people don't end up sick. So kind of with kind of this in mind, in 2016, we created something called the Pediatric Public Health Initiative, which is this partnership between these two long-standing institutions in Flint, Michigan State University and Hurley Children's Hospital, to flip the story for our kids. And we have put into place many interventions from literacy programs to parenting support programs, home visiting, Medicaid expansion, nutrition support services, mobile grocery stores, and the list kind of goes on and on of these science-based interventions that we are putting into place or have been putting into place. Our work is also very much done in partnership with community, which is so important in any community that anybody works in to do your work kind of really in humble shoulder-to-shoulder partnership. But it's especially important in communities like Flint that have been neglected for so long, but especially in places like Flint, where our story, if you remember, was also the story of lost democracy, where people's voices were purposefully silenced and dismissed. So that makes it kind of doubly important for our work to include the role of the people of Flint, to include their voices at the table. We've done this in several ways. We have a parent advisory group, but we also, my favorite thing is we have a group of children. They're called the Flint Youth Justice League that kind of guide us and meet with us and tell us what we should be doing. And these kids have not only kind of informed our work, but these kids have also, for example, worked with other communities like Newark, New Jersey, that's suffering from a very similar lead and water crisis. And our kids have been in touch with Newark kids and shared kind of advocacy tips and what they should be demanding. So it has been so inspiring every day to really to see the potential of our children and to see them creating absolute change. We also have created something called the Flint Kids Fund at our community foundation. We were really blessed when the crisis happened. We were kind of blessed with the generosity of the nation. We had so much water bottles that were donated, and we realized that we're going to need more than water to make sure that our kids are okay. And we created this fund as kind of a 20-year fund to help support all those things I talked about, like home visiting programs and breastfeeding support and literacy programs. We've been able to raise $20 million, which is amazing. We've given out about $10 million for exactly those kinds of things. It's still not enough if you look at the trajectory of the work that needs to happen into the future. Another one of our big projects is the Flint Registry. This is a massive project funded by the CDC to identify folks who are exposed to the crisis, but most importantly, get them connected to the resources to support their health and development. This is, the CDC granted us the designation of a public health authority. And the silver lining here is that because this registry was already built from the water crisis, it came in handy for this current public health crisis. So it was the built public health infrastructure that was able to support and continue to support a lot of families who needed to get connected to things like healthcare and nutrition services, and mental health care and trauma-informed services, and so on. I want to share a little bit about kind of the logo of the registry, this bird. This is the Sankofa bird. It was recommended by a parent at one of our parent meetings. And this really symbolizes so much of our work. It's a mythical African bird from Ghana. The bird is flying forward, yet looking back and holding an egg in its mouth. So it's all about kind of pushing ahead, pushing forward, about kind of the future. It's also about never forgetting the past. So once again, never forgetting the history, learning from our history, recognizing the injustices that happened before us. And the egg in the mouth is all about prioritizing children. This is one way that I'm tying in with the Pettingill lecture. So it's a little bit about ornithology here, but I think this is really symbolic of so much of our work in Flint. All right, so another way, and the registry is one way that we've been able to kind of share our best practices. Something that we realized really quickly is that the story of Flint is not isolated. Not just about the water issue, but it's a bigger story about children who wake up to nightmares, be it environmental contamination or lost opportunity or stolen democracy or, longstanding, disparities. This is not unique to Flint. And the registry is one way that we've been able to objectively share our lessons with similarly impacted communities. Another way that I've been able to share kind of our story has been through my book, which Newt mentioned. And I never intended to be an author. That wasn't kind of what I wanted to do when I was at the biostation, although I love to read and love to write. I stayed another year at Michigan just to take creative writing classes. My snail paper was amazing. No, I don't know. But I wanted to, I never intended to write a book. And then I realized after meeting my editor, who's this guy here, Chris Jackson, that this story of not just the crime that happened, but most importantly, the story of the resistance and hope that we've been able to build can really serve as a playbook for so many other communities who are struggling with similar issues, who also want to challenge the status quo and build a place that's better for their communities. So that's kind of how that process came to be with writing a book. It took a couple years to write it. It was entirely consumptive. I even recorded my audiobook, which was an amazing 4-day experience where I lost my voice multiple times. The book launched in June of 2018, so a couple years ago, and that was a surreal experience all over the nation on all kinds of different platforms. And the neatest thing that has happened has been the uptake of the book. I thought maybe just my mom would read the book, but so many people have read the book and enjoyed the book. It was a selected state book for 3 states, Rhode Island, Maryland, and it's Michigan state book. It's the Great Michigan Read for this year, and it's probably going to get extended until next year because of the pandemic. And has also been chosen as a common read for so many kind of universities, as well as classes and different themes, different venues. The book is The audience for the book is everybody. I wanted everybody to be able to read it. I easily could have written like a science-y book, but I wanted it to have a lot of the intersections that included history and race and geography and public health and medicine and science and economics and all these other things that are part of all of our stories. It's also a memoir, so it includes a lot about kind of who I am and where I came from. So it's also very much an immigrant story, and that also became surprisingly a relevant conversation as we began to question the role of immigrants in our country. So the last thing I have written is an article in the New York Times a month ago. And my first opinion piece was actually in the Michigan Daily. I also just had a chance to dig that up, which was amazing. And this was a piece that I wrote that was published in mid-May for a series called The America We Need. So, you know, I think there's been a lot of discussion about the pandemic, about the issues with racial inequity, and how can we finally learn from our history and emerge from this crisis to be more fair and to be more resilient. So I wrote this piece reflecting on kind of my experiences in Flint, in public health, with kind of environmental health issues, but really with kind of the injustices that so many of our children face, and how we can do better, especially as we work to hopefully build a more fair and more just nation moving forward. Thank you. My time is up, and you know, that's another picture from being at the biostation and obviously the snail. So I just want to once again thank the biostation. I would not be here and be who I am and be the scientist that I am without that experience at the biostation. So I am so grateful. And if you give me 2 more minutes, I'm going to tie back into the Pettingill lecture. So the last chapter of my book is called Hedgie and the Birds. The Audubon Society really liked this chapter because it was all about my grandfather, who had a great love of birds. So I'm going to read you a little bit of this chapter, and then we can move on to Q&A. All right, so it's called Hedgie and the Birds. One night, I'm working late, and I hear Bibi, which is my mom, helping Elliot get the girls ready for bed. Nina says she isn't sleepy and never wants to go to bed. Layla pretends not to hear. She is dressing the cat. Hold on, let me pass a little bit of this. Okay, as soon as the girls settle in, I hear Bibi's gentle voice again. She isn't reading a book. She's telling the story of Hedgie wa Asafir, which in Arabic is Hedgie and the Birds. It's a family fable that has been passed down, a story my mom heard from her father Hedgie when she was little, and later used to tell my brother and I. It is about a young man named Hedgie, but we all know that my grandfather was that young man, which makes it more vivid and intense. All right. Let me see 1 second. It's okay. Okay. Once upon a time in Baghdad, there was a young man named Hedgie. He loved nature. He loved flowers. At his house, he had a garden of citrus trees and date palms, pomegranate trees and flowers. Most of all, he loved birds. He loved their freedom. He loved the sounds of their singing, blackbirds, whitebirds, yellowbirds, big birds, and very little birds. Every morning, he opened the window to hear their different songs. He loved the cooing of pigeons. He loved the chirping of little sparrows. Each song was different and separate, but together the birds made a beautiful symphony. Every morning, he walked outside with a bowl of grains and rice and seeds. He made a feast for the birds. They would fly down, and Hedgie liked to watch them eat his feast, then drink from the flowers. He became friends with all of them. Some birds even ate from the palm of his hand. The garden was such a simple and peaceful place. One day, after feeding the birds, Hedgie climbed a ladder to pick dates from a palm tree and reached for a branch slightly too high. He fell off and broke his leg. He called out for help, called and called, but nobody came. A small bird flew down and tugged at the hem of his white dishdasha, which is his pajama. The bird told Hedgie that he would take him to the doctor, But Haji laughed at the small bird, wondering how such a tiny bird could carry him. Soon another bird came and took the edge of his sleeve. Another bird came and another, until hundreds of birds surrounded him. They each held a piece of his dishasha and even his hair and his toes, and together the birds were able to lift him and fly him through the air. They flew him over the palm trees, the majestic meandering Tigris, the statues of ancient poets, and the impossibly blue minarets and cramped alleys of old Baghdad. It was a magic carpet of birds. And they flew him all the way to the Baghdad hospital, where a very kind doctor took care of his leg. In a few weeks after his care, Haji was much better and went out into the garden to see the birds again. Thank you.
What a perfect tie-in for our Pettingill lecture. Thank you so much, Dr. Mona Hanna-Attisha. I was personally on the edge of my picnic table bench here from the biostation. So now I'm going to go ahead and read some questions that we have coming in. By the way, I haven't introduced myself. I'm Jenny. I'm the communications person for the station. So Dr. Mona, we're all applauding you wherever we are. And I'll read some questions, and everybody please feel free to keep submitting some questions here.
And while people are submitting questions and Jenny's going to read questions, I just want to thank again Dr. Mona Hanna-Attisha for coming, and I want to thank Jenny for her amazing organizational skills. Thank you, Jenny, and Jenny will read the questions.
Thanks, Snoop.
Thank you all for listening in and viewing.
All right, so first question here from Tim and Alice. Hi, Mona, great to see you after all these years and to see you've done so many great things. Question, would I'm not sure if I'm saying this right, chelator, like a DMSO, help to remove lead from the body, or after years of exposure, has the lead already done its damage and already left the body?
So I think Tim was in one of my early pictures of the biostation. I think that was the same Tim. I hope, maybe not. So great question about chelation. It's probably the most common question I get asked. So chelation is a way to bind lead or whatever in your body and to help excrete it. So chelation is used for very high levels of lead to prevent the acute consequences like seizures and coma and death. When I was a resident in Detroit, where we had many more cases of lead poisoning, at higher levels of lead poisoning, we always had a kid admitted to the hospital who was undergoing IV chelation. However, research to date has not shown any neurodevelopmental benefit of chelation, and it can actually also cause harm. So kids who do undergo chelation, there's no change in their outcomes, their cognition, their behavior, their neurodevelopmental outcomes. When lead comes into your body, it's in your bloodstream for just a short period. It has a half-life of about 28 days, but then it gets stored into your skeletal system, like your bones and your teeth, where it can last for decades. When you chelate, you run the risk of pulling those stored skeletal lead back out of your skeletal system and back into the bloodstream and causing neurotoxicity all over. So chelation actually has a risk of causing more harm and re-exposure.
Thank you. So another question. What specific parallels do you see between the Flint water crisis and what's happening now with the COVID-19 pandemic?
That is an awesome question, and there are so many parallels. So the lessons of Flint are that we need good governance that values public health, that we need to value science and scientists, that we need to have robust investment in public health infrastructure. We just can't fight a crisis and expect to have an infrastructure in place and the capacity in place to do that. And the lessons of Flint are that not everybody bears the same burden when it comes to public health crisis. There's disparities. Those are the exact same lessons of this pandemic. We see a failure of governance that doesn't value public health. We see a disrespect of science and scientists in the medical community. We have grossly underfunded, undervalued public health infrastructure, surveillance systems, the CDC, state and local health departments for so long that are exacerbating our condition. And once again, like in our preventable public health crisis, we see the disparities. This is not the great equalizer. Just like Flint's crisis has been said would never have happened in a richer or wider community. And we are also seeing those same disparities. So many parallels. And kind of, I'm a very optimistic silver lining kind of person. I'm hoping that the lessons that we learned in Flint that are now national lessons will finally be taken to heart, so that we can prevent these things in future.
So Dr. Mona, a question from Matt. What ideas do you have or have you heard to bolster the city of Flint against systemic injustices?
Yeah, that is a great question, and I think that's a question that people are trying to address everywhere. Flint is also a city. There's been many injustices in Flint, like many cities. I kind of touched on the geographic kind of segregation issues. There have been many efforts in Flint history to regionalize the city, including an effort back called One Flint. So, you know, there was a massive exodus of white folks into the suburbs, and then that decreased the population and decreased the tax base, and it became impossible for the city to maintain any kind of infrastructure, including water, but also schools and policing and public health. So I think one way that has been tried before is to regionalize services and tax bases, especially. My brother lives in Virginia, and there's no mayors of cities. Everything is at a county level. So there's not all these different school districts or different funding schemes. Like everybody, wherever you live in the county, gets the same, you know, school systems. Like I think that could be done at a bigger level. I think that's one thing that can be addressed, especially when you have a significant loss in populations of these cities. But there's also efforts that, you know, there's criminal justice issues that need to be addressed. We have a lot of folks who are incarcerated that don't need to be incarcerated. We need more mental health services. In the article that I mentioned in New York Times, I also call for reparations and resources to these communities that have been systemically neglected and have been kind of the victims of these historic and current injustices.
So as a medical expert, what relationship do you draw between water pollution in general and illness in the human body?
You know, I haven't studied this exact question, but it can't be good. I mean, like any kind of water contamination impacts health. Water is a medical and public health necessity. We need water to live. You know, the younger we are, the majority of our body is made up of water. And like I mentioned earlier, for the youngest children, that's pretty much all they consume, especially if they're formula fed. So any contamination of our water, be it lead or microorganisms or what have you, that shouldn't be there will impact health outcomes. And the hard thing with the whole kind of field of environmental health is the difficulty it is to prove causation. And we're in kind of this catch-22 where, like, are we sure it was this that caused this? And with environmental health, sometimes you don't see the consequences of that exposure for years, if not decades, if not generations later. And we can't really afford to wait. You know, we can't assume that it's going to be okay. So be it lead or PFAS or any other issue that's not supposed to be in the water nor in our bodies, we should proactively be working to eliminate that exposure.
So this question asker says, currently in the middle of reading your book, and I'm wondering why people didn't seem to learn much from the water crisis in DC and why it wasn't publicized as much.
That's a great question. So there was an even worse lead and water crisis in Washington, D.C. in the early 2000s. That's where my friend Elin was involved in. Mark Edwards, who helped uncover the Flint water crisis, and uncovered that water crisis. And then once you start digging around, you realize, oh my gosh, even the DC crisis wasn't the first crisis. There's a great book, if anybody is interested, called The Great Lead Water Pipe Disaster. It talks about 150 years of lead and water crises. I talked about the Romans. In England in the 1890s, there was a community that had a lead and water issue, and they noticed that all the pregnant moms, not all, many of the pregnant moms lost their babies. And because of that, one of the very first abortion pills was invented in the early 1900s. That was a lead pill based on that lead and water contamination. So we have had many incidences of lead and water issues, but they've gone largely under the radar, and not much has happened. And I think it is because of the power of the lead industry at that time. The lead industry formed a conglomerate called the Lead Industry Association, the LIA, and they really were a powerful interest group that thwarted regulations, that put doubt in science, that called for more research, and that attacked parents, blamed victims, often minority victims, and try to keep a lot of this under wraps. This has also been seen with water issues. The water utilities have been playing a similar role, not wanting to have anybody believe that their water is not safe. To this day, they continue to minimize lead and water. One of the wonderful silver linings of what happened in Flint is that Michigan adopted a model lead and copper rule, which exceeds federal standards and which demands that all of the lead pipes in Michigan are replaced over the next 20 years. This was an uphill battle. The water utilities in the state, as well as several cities, sued the state because they did not want to deliver water that had less lead in it, because there was a cost to that, and a cost to their reputation, that where folks now think or now recognize that their water is not safe. The national lead and copper rule regulations are abysmal. We were never intended to have lead-free water. There's a lot of interest that want to keep the status quo and not address that either.
Which is a very good lead into this next question. You partially addressed it. So Lansing and Madison, Wisconsin are the only two cities in the country that have replaced every lead pipe. Do you foresee most cities following suit?
I love that question, Daniel. That's awesome. So Flint will be the third city, and we're almost done. Just last week, there's a U of M group that released the Flint lead map. So a beautiful map, unprecedented. You can click on every single address and find out what kind of pipe they have. So by lawsuit mandate, all Flint's pipes will be replaced this year, 2020. And many more cities, this is one of the great ripple effects. Many more cities are following suit. Michigan, like I said, this model lead and copper rule will replace all of their lead pipes in the next 20 years. So that's happening. And many communities are already doing the inventory because they don't even know where they have lead pipes. But many more cities since have also done that or are working on it. Newark, New Jersey, Milwaukee, Sebring, Ohio, like the list goes on and on of communities because of the awareness of Flint that are now investing in this. Well, the last time I testified in Congress was about the lead and copper rule and how we really need federal infrastructure dollars to help do this work. The cost of replacing these lead pipes, even though there's a societal economic cost when you look at healthcare costs and mental health care costs and education and criminal justice costs, the cost of doing that pipe replacement work is often borne on ratepayers. And we have a significant issue, especially in Michigan, with water affordability, and we don't want to exacerbate that. So we do need some federal investment in infrastructure to do this at a larger scale.
Great. And we have a question from our illustrious director, Newt, scientist, activist that he is. So Newt asks, how can we as citizens better work to hold our regulator agencies, EPA and others, accountable for mismanagement such as what occurred in Flint?
Yeah, so that's a great question, and you touch on accountability. So I'll get to what we can do as individuals, but I'll also get to the status of accountability in Flint. If a lot of folks are curious there. So the accountability in Flint is incomplete. And I think that was kind of one of the hardest things about like writing a book is that our story is nowhere near over. The criminal charges were dropped and they're being restarted. Those charges also included homicide charges because of the deaths from Legionnaire's disease. Some of the greatest culprits in my eyes, which were the regulators at the Department of Environmental Quality, have already been kind of, they had a plea deal, so they'll never be held accountable. There's also civil cases which are ongoing and hopefully will be near settlement. So the big picture accountability of those who are responsible has still not happened in Flint, and there's a concern about running against the statute of limitations. But then how do we hold people accountable? What do we do if we're concerned about anything in our community? And I think that's kind of one of the greatest lessons of this story is that, oh my God, we can do something. Like, here's the story of Flint, which was like, oh my God, a crime committed like with absolute indifference against some of the most vulnerable people in this country. Yet it's also this amazing story of how everyday people like moms and pastors and activists and students and scientists and doctors came together and held people accountable and refused to accept the status quo. And that was by being inquisitive, by being curious, by asking questions, by kind of verifying before trusting, and by literally holding people accountable. Our partners in all of this work were journalists, so I can't underestimate the role that media played here. So if you want to do anything, subscribe to your local newspaper and national newspapers and state newspapers so that we can continue to have more eyes on the ground that can hold people accountable. There's a Society for Environmental Journalism, which also does great work in this kind of niche area that helps bring a lot of these long-standing environmental issues also to light. And I think the most important thing that we can do is, there's many important things we can do, but we can call our elected leaders, we can ask, questions, we can meet with them. They respond to folks who voted them in. It's always humbling when I interact with any of our elected policymakers, and you realize that they're just regular people. They're just regular people like you and me. And you have something to share, and it's their job as public servants to listen. And as much as the story of Flint is kind of the story of like government gone bad, it's also for me the story of how government can work for people. When our elected officials, especially our 2 U.S. senators, Stabenow Peters, Congressman Kildee, our state senator, our state rep, finally knew what was happening, they never stopped fighting for Flint. And for me, it was reaffirming of what a public servant can be and how we can hold people accountable. But I think the most important way of holding folks accountable is voting. So please vote, please vote, please vote. Take 12 people with you to go vote.
Thank you so much, Dr. Mona. That's a great actionable list to end on. And with that, I will thank you. I'll thank everyone who's submitted questions to our question and answer section. And I'm going to turn it over to Newt just for a moment for a final word.
Well, thank you, Jenny. And all you will hear from me, Dr. Mona, is thank you, thank you, thank you. This was a wonderful talk. And we can't wait to get you up to the biological station in person with your family so you can re-experience life here. And maybe someday your kids will be students here.
I would love that. Thank you. And I noticed that one of the attendees is Paul Webb, who was my mentor in the School of Natural Resources, an amazing faculty member who I wouldn't be here without him as well. So it was great to see his name, and it was great to interact with all of you, and I hope we can do this in person sometime.